Well, good morning, everyone. Good morning, Dr. Jameson.
Good
Thank you
morning.
so much for joining us today. And those of you watching online, I'm Dr. Brandy Basket, the Chief Health Officer here at Neighbor Care. And welcome to our first ever Spring Give Community Chat. I'm new to the area, and I'm excited to take on this role and address health inequities by looking at our quality data here in Neighbor Care, what we've heard from the community and patients, and we've been really zooming in on that here at Neighbor Care. As previous medical director in Death Brown, Dr. Danielson, and now working further upstream with Akshay. Can you introduce yourself and tell us how you're addressing healthcare inequities?
First, I just want to say thank you. Thank you for allowing me to be like part of your inaugural community chat. This is so exciting. And I'm so pleased that you are in your leadership role here at Neighbor Care. It's amazing. I'm so looking forward to working with you, and just feels like bright futures when we have a chance to collaborate and build on a legacy of great work from Neighbor Care,
Right.
and the chance to just reflect on what's important for our communities. So I'm Ben Danielson. I'm trained as a pediatrician, worked in primary care for quite a few years, and still working with young people, but focusing on some specific issues like youth incarceration.
Awesome. Amazing.
Yeah.
And I forgot to mention, I'm a family practitioner by training, and I'm originally from Detroit, Michigan. So
Right.
yeah,
All right.
great. I'm happy to be here and serving the Seattle area. So, so tell us more about Akshay.
Akshay. So full disclosure, I kind of made up an acronym so that it would spell Akshay, because I just want to say Akshay all the time.
I was wondering.
Yeah, I just want to say Akshay as much as possible, because I think part of what we do and what we put into the universe is our expressions of hope and unity and the power of us. And I think there's no better kind of expression of that in our communities, right? Than Akshay. So yeah, that's mostly what that's about. It is also about lifting up the promise, the gifts, and the talents of young people, especially young people who maybe we looked like when we were young.
Right.
And really thinks about not only tearing down the fortifications of harmful things like incarceration, but also building up fortifiers of hope and health and bright futures for youth, like Neighbor Care does. Yeah.
And what does Akshay stand for? I want to know.
Allies and Healthier Systems for Health and Abundance in Youth.
Okay, awesome. Thank you.
I told you it was clunky. I'm just staying with Akshay, okay?
That makes sense. Awesome. So we know nationally that we see healthcare inequities with various things like high blood pressure and being uncontrolled in African Americans and Hispanic community, maternal fetal health. We see it a lot in the news now. I know have seen it nationally, but what do you see here locally in Seattle?
The same things you see nationally are happening locally, of course. We have all the same dynamics of racism and oppression that are causing these inequities to occur. And let's be clear, it's racism, not race, that are causing these inequities. And we just need to kind of understand and focus in on that kind of perspective. We see a community that is amazing, brilliant, incredible BIPOC, Black, LGBTQIA, Two-Spirit plus communities around us here, which have so many gifts to share with the world and so much of their own power and strength if we only recognized it better. We also see ways in which systematic oppression kind of happens, how resources to neighborhoods get bled away, how neighborhoods themselves are split up and pushed apart, and how we have systems that seem to push some people in one direction and some in another. Great promise. We're like the country, a region of incredible wealth. Nobody can tell me that we don't have enough to do what's right for our people in this community. Nobody can say that and hold a straight face. I also think that we have a lot of caring people. We have a lot of people who have strong interests, and sometimes there's a lack of will, and sometimes there's a little bit of a lack of collaboration. We get split apart. It's almost by design that people try to split us apart, try to make us kind of spiral into our silos. I feel like the history and legacy of Neighbor Care and the strength that exists in the communities that it has served for so long is really about people power, and the ways in which the time we spend with each other is so precious.
Yeah.
The opportunities to do more together. I feel like that's probably like speaking to your heart too. I'm wondering like what brought you to this role? What made you say yes to Neighbor Care?
Absolutely. So, again, I'm from Detroit. I was a Medicaid kid. So I've always wanted to go back and help, those who needed me the most.
Yeah.
That's where my heart lies, and I love family medicine. I can
Mhm.
see anyone from any age, right?
Mhm.
So when I initially started out of residency, I worked at only basically federally qualified health centers, FQAC. So I was the FQAC
All the
doc
way.
seeing the patient all the way,
All right.
all the way. And then I got a little burned out and I went over to the insurance side, which was very eye-opening, right? I was able to see what it looks like on the other side,
Yep.
insurance
And that
companies,
curtain.
big behind the curtain, right? Big bad insurance companies, right? Or are they? Right. So it was really great to bring and shine a light that there's actually doctors there at the insurance company that are helping making the decisions and then understanding like bringing my provider FQAC experience to like the Medicaid health plans to say, this is what the population needs. This is what they need. Where you all are moved. Let me help bridge that gap, right?
Yes.
So I love bridging the gap. So what brought me here to Seattle to Neighbor Care was the opportunity to utilize all my experiences in this role, right? Looking at quality and quality data.
Yes.
What does the population need? Not just making a guess, right?
Yep.
What's the data telling us? What are our patients telling us? What is the community saying, right? All those things matter. So bringing it all together and doing good work here, Neighbor Care is what brought me here. It was just a great role for me that brings together my clinical and my health plan experience.
Yeah, all your talents, like it's almost like you're preparing for this moment in some ways.
Exactly. I feel that. Yes.
Wow. What's your leadership style? How do you like to lead?
Yeah, collaborative. I love to collaborate. I call myself like the hub in the middle, right, in the wheel. So I love to collaborate. I love to bring people to the table. I love to connect things. Like I hear a person saying, like, wait a minute, I know we're doing something over here. Let me put them together. Or let's make sure before we make this decision, we have all the people at the table. Let's think about everyone.
Right.
I'm not a big fan of silos. So even community-wise, right? I had the opportunity to attend the health fair on Saturday, the community event, which was amazing. I got a chance to meet different local community partners, and I came across a Neighbor Care patient actually at one of our clinics, which has been fabulous. And which brings me to my next point. When we look at, Neighbor Care, population, like our patient population and our providers' current state, I realized there's a gap here. And that was highlighted when I met this particular patient. So it happened to be, she said, Dr. Baskett, I don't see a provider color.
Yes.
And I said, huh.
Okay.
You know what? But we do. We have someone. We have a provider who you can see and let me connect you all, right?
Yeah.
And so that was really good for me to be able to happen across this one patient. I actually did have, we have a person of color at that particular clinic that she's at, right? We have 31 clinics, school-based included, medical, dental, behavioral health, all these things, right? But it was wonderful to be able to make that connection. But we realized though, right? Our current, like the current providers right now don't reflect the community. And that's something that we do need to lean on. Have you seen that here in Seattle? Is that something that's seen in other places or what you see?
I think it's here more than possibly Detroit. It feels harder to find someone who looks like you, someone where you can have, that kind of conversation where you're just like, I think you understand what I'm going through. You understand how life is working and for people like us. And it's so important, right? You know what I love about that story though? I just gotta say, I know you as somebody who sees opportunities, sees challenges, and you find solutions in those. You could have just walked away like, oh, I'm so sorry about that. Or you could have just, I don't know. But you went right for the human component there and really tried to help somebody in that moment when they express something. So I just want to get your flowers for that. Because I think that's just, that says something really special and just new on the beat. Like you're just guy here and you're doing that. That's really beautiful.
I appreciate that. It's I think because coming from the same community, right? I know how sometimes you don't feel like you have a voice or you can be an advocate for yourself. And I think that's the other thing we want our patients, right, to know is be able to speak up and feel confident in saying, I want this type of care, or explain more, right? Just empowering. So I just wanted to make sure, again, bridging That's, I'm
Mhm.
like to bridge.
See that.
Yeah,
I really think about also our elders in our communities, and uh, I just got to be real. I think America does injustice to honoring elders and ancestors, and really lifting up people on whose shoulders we've been riding.
absolutely.
And I think about that and the opportunities that neighbor care has across communities. And I'm a pediatrician at this other end. I'd love to hear like how you see care for our Black and brown elders in our communities and how neighbor care fits into that.
Yeah, absolutely. I think, one of the things that we need to focus in on is, I agree, our older ancestor community. I know that, one of our focuses this year is really, making sure we're getting them in, for the needed, well visits to assess them for fall risk and making sure they're able to take care of themselves, making sure that we have other specialists, right? Their medications are correct, making sure there's no interactions that are occurring and causing them to be dizzy and fall, right? And those things, right? Looking at them as a whole person, right? Those visits are so important. A lot of our elder population has Medicare. So we need to get them in for those special visits that's covered, just for us to take the time and make sure they're safe, that they're getting good quality care, needed vaccinations, anything, right? To keep them, at home as long as we can, because we know, people want to be independent. Everyone wants to be independent, right? This is a temporary state you and I are in. We will be there one day, right?
So sooner than I probably yeah.
But we want to make sure we're bringing them in and looking at making sure they're safe, right? Making sure they're comfortable, so.
And feeling a sense of dignity.
Absolutely.
I think that's been at the core of my sense of neighbor care for a long time, is that people feel like they're seen in your spaces. And so I appreciate that.
Absolutely.
So moving from Detroit to here, like, what are you finding outside of the workplace and space that excites you about being here in the Northwest, in the evergreen spaces?
Yeah, so once in a while, Mount Rainier comes out. So I love to see that.
I've heard of it.
I've heard of it. I call it a mirage.
Yeah.
I really do call it a mirage. I've seen it like 5 times.
Right.
Since I got here, but I love it here. It actually reminds me of Michigan.
Oh, yeah.
It's very similar, but you have mountains. We have water. You have water and mountains. I love it's a good feel. I'm excited to explore once everyone comes out of hibernation, because I hear this hibernation time for you all. But for me, I think it's sunny every day. I know this is cloudy for you all, but I'm from Michigan, where it's the dark cloudy. It's the cold, although you all did have that 17 degrees when I got here in January that weekend.
Didn't even know our thermometers went that low. I feel like you bring the sunshine too. We need to materialize the experiences that we want to see. And I think that's wonderful. I think a lot about wellness on that whole spectrum. Like we deserve beautiful communities to walk through, trees to shade our spaces, and parks to play in, and intergenerational opportunities and things like that. Really trying to think about what the community of the future looks like for us, for our communities. I think about intergenerational spaces where a young person sees an elder, where a young girl sees you and says, I could be like her when I grow up because she looks like me. I see places where our physical health is lifted up and where we have opportunities for play. And even with my broken down joints after way too much basketball, I just think staying healthy and active is important. I see spaces for people to come together and talk about their real issues.
Absolutely.
A town hall kind of experience of like, we need to address this issue because it is important to us. We're not waiting for somebody else to decide for us. We're deciding what we need. I don't know, are there other things you think about what it makes for the beloved communities that we deserve? Yeah,
I mean, I think what neighbor care is going to be pivoting toward is being back more in the community, right?
Yes.
Showing up at health fairs, doing health fairs, back to school fairs, those things,
I love that.
because we want to meet people where they are, right? We need to get out in the community, see them again, talk about the data. Where do we need to be, right? Where do we need to educate on diabetes and why you need to take that insulin? Or
thank you.
How can we help you get the insulin, right? Understanding barriers, right? Sometimes you have to balance out your food versus this medication, right? That someone wants you to take, right? So I think getting out into the community and meeting them where they are, where we're gonna pivot.
Love that. So I'm hearing a depth of experiences both on the clinical side and on the sort of systems of care side. I'm hearing something about somebody who knows where they're from and wants to make sure their people are well taken care of. I'm hearing somebody who has a can-do approach to things. You bring your sunshine, you solve problems when they're there, you don't wait for someone else to deal with them. And I see somebody who's part of a community of care through neighbor care that has kind of always been there for our neighborhoods. It's like a perfect matchup.
I
It's
appreciate
beautiful.
you saying that, Dr. Danielson.
Yeah.
Thank you. And the good work you've done and you continue to do. Tell me more about actually, like, tell me, some things you
Yeah.
all are working on right now.
Well, I believe that there is so much we can do from a community perspective, that our communities know exactly what they need. And that we could be lifting up more of the community-based programs to make sure our young people are seen, have a sense of belonging, which is absolutely fundamental to how you see yourself in the future as a young person, are understood for their brilliance. They're not just like unfinished adults. They're actually fully brilliant young people. And I think we need to make sure that we never act as if we are allowing people to be thrown away in our society. We all have these important gifts. We all have these things to offer. And even our hardest experiences sometimes create our smartest experiences.
Absolutely.
And so that kind of growth, we just need to start recognizing that.
Yeah.
We can't afford to waste people's lives like this. And I think that if I could be serious on this for even another moment, we are in a time when it feels like we're starting to try to recriminalize our Black people. And so it feels really important right now for us to stand up, like shout, like be loud and proud and very clear that we are not going to allow ourselves to slip back to times when putting people in prison was the main industry of so many communities and systems. I think we have a better story to tell for our future. I think we have ancestors that have a better path to help guide us on. I'm very Sankofa in my thinking, if you know what I mean. And I believe in young people.
Right.
If we could only pause in what feels like a busy life with so many things, so many messages, sometimes geared just to scare us. So many ways in which other people are telling us who our young people are. If we could just pause on that. We could just stop and listen and think and wonder what's possible. What can we see in our future? What can we lift up? How can I stop talking, get out of the way and let young people say what they need to say about themselves? It's all a journey, right? And we have a debt that we owe going past and going forward. Our time on this planet is all about doing our best to serve that debt, to serve that opportunity, to see ourselves as better people, plural, by being better people individually. I think I see that in you. And I feel like we're going to work together in great ways. We're going to have hard conversations, right? We're going to just say it like it really is. And then you're going to say, okay, well, what's next, Ben? Like, what are we going to do about it? How are we going to move forward? And you're going to hold me accountable. So
I'm sure.
Yeah, you're all right. Yeah.
Great, awesome. Well, I want to thank everyone for joining us today, and thank you to Dr. Danielson for coming down and meeting and chatting with me and participating in our first, again, community chat here.
We gotta let's just keep this going. I know you want to invite other people, but maybe every other, I can come back. We can do a thing. We can talk about. That amazing women's NCAA tournament. We can just lay it all out.
That phenomenal
We can just start ourselves up. Like, let's turn this into something big. Yeah, I love it. I love the idea of this chat, and I'm just really happy to be here with you.
Thank you so much. And thank you for everyone who tuned in. Please support Neighbor Care in our Spring Give. We've had the link in the chat. So please click to give for a Spring Give. All right.
Right.
Thank you so much for joining us.
Thank you. Very honored to be here.